Hey there, podcasters. Welcome back to Under the Avocado Tree. On this episode, I am extremely excited to be able to connect with Dr. Ivette Mercado. Dr. Ivette is a doctor of optometry since 1989. She's been in private practice in both Puerto Rico and the United States. She's worked with an ophthalmologist as part of a primary eye care center and has been responsible for co-managing cases. She's now been a full-time faculty member of the School of Optometry of the Inter-American University of Puerto Rico for almost 20 years now. Her special interests are in primary eye care, ocular surface disease, and glaucoma. She's collaborated and participated on posters, publications. She's a lecturer of the American Academy of Optometry conventions, and she is a CE credit provider for optometry doctors in Puerto Rico. She also serves as an advisor for students, associations, and is a volunteer for optometric services in Puerto Rico and Latin America. Holy moly, Dr. Ivette. That is quite the resume. How are you doing today?
I'm doing good. Thank you for inviting me. It's a pleasure to be here.
Thank you so much for being with us. So, Dr. Mercado, right now we are experiencing an unprecedented time. We are living the COVID-19 pandemic, something that is completely unexpected and quite concerning, right, for our generation. And I think it's going to be something that's going to become very historical. Most people right now are at home and they're worried, they're concerned. Main two concerns are health, either preventing the illness or dealing with the illness in the best way that they can, or on the other side, dealing with financial stress or stress around the future. I know that in your expertise, you are incredibly well educated around everything that's ocular health and just health in general. So let's open up a conversation about what's going on right now and ocular health. What are some important things that we need to know and take into consideration?
Well, right now, as you know, this pandemic, we received the alert by a physician that it was an ophthalmologist in China. And unfortunately, he died. And we believe that it seems that he was infected by one of his glaucoma patients that was asymptomatic. So we have to keep an eye on that it seems that the virus can be transmitted by asymptomatic patients. So we have to protect ourselves. As you said, we have to stay home. We have to go out. We have to protect ourselves when we come back, clean everything. And very important, wash your hands a lot, okay? Because it's not only that you can be infected by somebody that is coughing, that is obvious, that is sick. It could be also from somebody that does not show any kind of symptoms. The nursing home in Washington State, that you know that many of the people that were living there died, they found that about 30% of the patients or the people that were living there were positive for the virus and they were not showing any symptoms. Okay, so they were spreading it. Okay, so we have to be very, very aware. In the surfaces, the virus, we know it can be plastic, stainless steel. Now we know that you can collect air, a small study that was done in a hospital. That doesn't mean that you're going to catch it through air. Okay, it's not like measles that is an airborne microorganism. It is in the air probably, but it has not been able to be cultured. Okay, so it's not going to cause you the disease. The disease, it will be caused, as it seems, if it goes through the mucous membranes. Okay, and we do have mucous membranes in the eyelids, inside the eyelids, in the conjunctiva, in the nose, in the throat. Okay, so through there, we can get infected. Right now, there is a concern with conjunctivitis. Okay, the conjunctiva is that little membrane that we have in front of the white area of the eye. and also it's the pink surface that you have inside your eyes. It has been found that about 1% of the patients that have the COVID-19 can show conjunctivitis, okay? So it is suggested that maybe this is an early sign, because that in that nursing home also many patients had pink eye before. This conjunctivitis is a viral conjunctivitis. Like any other conjunctivitis, you're going to have some signs. But the thing is that we don't want people to be touching their eyes. That's very important, because if you touch something, that a surface that had the virus, and then you put your hand in your eye, then you can catch the virus. Okay, so seems that conjunctivitis can be an early sign. It's not that everybody is going to get conjunctivitis with the COVID. But here comes the question that many of our patients are asking. I'm a contact lens wearer. Can I still wear the contact lens? Okay. There's no evidence showing that you're going to have a higher increase of catching the virus if you're wearing contact lenses, okay? But it's very, very important that you follow protocol, okay? Because if you do not wash your hands and you put on your contact lenses, you can get it, okay? And amazingly, I don't know if you ever remember your mom telling you that you were drinking your tears. Really, we drink our tears, okay? Because the tears, they are collected in small apertures that we have in the eyes, in the nasal area and below, and it goes through like some tubules, very small, and then they end up in the back of your nose, and from the back of your nose goes to your throat. So you're drinking your tears, okay? So that way you can catch that virus going from the eyes to the nose to the throat, and from the nose to the lungs. Okay, so it's very important. And washing. It's been amazing how well kids are learning how to properly wash their hands. Okay, so we have to follow that protocol. If you're wearing contact lenses, you have to be very conscious, okay? Number one, what kind of contact lens are you wearing? Are you wearing a contact lens that is a hard contact lens or a rigid contact lens because of certain conditions, like patients that have really dry eye or certain conditions, they need to wear a scleral lens, which is a big lens for treatments. So those patients cannot stop using them. Other patients are using the contact lenses because they're in a treatment. It could be for myopia control, that we know that there's an epidemic in terms of myopia, and there are going to be millions of people myopes eventually. Also, you can be wearing contact lenses because your prescription is so high that the images are more distorted with eyeglass than with a contact lens, okay? So those patients, it's very difficult for them to stop wearing the contact lenses, okay? If you're wearing a contact lens just for cosmetics, that you want to change your eye color, now is not the time to be wearing a soft contact lens like that, okay? You can just wear your normal contact lenses if you take proper precautions, or your eyeglasses, okay? The other thing, if your contact lenses are soft and they were prescribed for daily disposable, do that, okay? Don't try to overextend the life of the contact lens. There's a reason why the eye care practitioner recommended to you a daily wear. Many times it's because you have an allergy, or you have certain surface conditions that is much better for you to wear a daily. And on top of that, if you wear a daily wear disposable lens, you don't have to use disinfecting solution. It is something fresh and clean every day that you're going to put in your eyes, okay? If you have a disposable lens, that is what we call frequent replacement. It's not that you throw it away every day. You have to throw it away every week or every 2 weeks or every month. That means that every night you should take them off and put it in disinfecting solution. The disinfecting solution, make sure it's disinfecting solution and not saline solution. So go And check right now if it says disinfecting solution or saline solution, because they're not the same. The disinfecting solution, many times they're multi-purpose. You can use it to rinse your eye. You can use it also to disinfect your lenses and keep your lenses there until you're going to wear them, okay? So disinfect the lenses as they were told you, okay? And then dispose the lens when you're supposed to dispose them. Don't try to stretch them because the material also is going to deteriorate, okay? The other thing, as I said, do not overwear your contact lenses, okay? For many years, the contact lenses, they have the instructions. There are different kinds. Some are peroxide based, other ones are not, many are not. And you just have to keep them the amount of hours that the package tells you. Very important also, as I was saying, dispose the lenses. Don't try to stretch the life of the lenses. Sometimes the materials that deteriorate. You want good oxygen going through your cornea so we don't have complications. Very important also, clean the contact lenses cases. Okay, you're supposed to throw away the cases every 2 months and have something fresh and new. Don't use tap water. Use the same disinfecting solution to clean it. Cases are usually filled with a lot of microorganisms and sometimes are the reason why the patient can get an infection. At any sign of discomfort that you notice that your eyes are red, or you have irritation, or you have pain, stop wearing the contact lenses and contact your practitioner, especially if you have pain or if the redness does not go away in, let's say, an hour, okay? And that's why you should always have glasses just in case, okay? It doesn't matter, they don't have to be very expensive, but at least have a backup of glasses or spectacles, okay? And I would say again, you need to wash your hands really well, okay, before you handle the contact lenses, and you're going to dry your hands with paper towel, okay, with a new paper towel, especially at this time. Many studies have shown that the vast majority of the infections, microbial infections in the cornea related to contact lenses come from not washing their hands properly.
Wow.
Yeah.
So a couple of questions on that. You mentioned that for some patients, for a percentage of patients, one of the earliest symptoms of a COVID-19 infection is conjunctivitis, specifically a viral conjunctivitis. Clinically, when you are looking at the eye, are there distinct differences that can be identified by a trained provider in the presentation of a viral conjunctivitis versus a bacterial or a fungal conjunctivitis?
Definitely. There are different types of conjunctivitis. The most common ones are the bacterial, the viral conjunctivitis, the allergic conjunctivitis. And you can start just by, as a practitioner, by the symptoms. If the patient tells you that there's a lot of itching, and you notice that the eye is red, is more like a pinky red, a pink color. And the patient most probable thing they're going to tell you that they have episodes like this before. And then again, a lot of itching and kind of like a whitish mucus secretion, stringy white secretion, that is allergic type. When we look in our equipment that we know as like a biomicroscope, we find changes on the conjunctiva known as papillas, okay? When you have a bacterial conjunctivitis, usually the patient is going to have yellow-green secretions, and the redness of the conjunctiva is going to be what we call meaty red, like meat, okay? And when you have a viral conjunctivitis, like in this case, many times the patients have been ill or have a cold or have had a cold. Usually it's a watery secretion, okay? Like the eye is watery, but the tears are more kind of thick. And the redness is more towards what we call the fornix of the conjunctiva, which is the eye is going to be red, but you're going to notice more when the patient looks up, down in the eye. That's where it's the most redness. And the other thing will be when we look at with the special microscope, we find follicles, and these follicles, they are lymphatic material. Okay, so it's fighting whatever is there. Also, when you have viral conjunctivitis, the practitioner can check the preauricular nodes that is in front of your ears to see if they are swollen. Okay, and many times in some of the viral conjunctivitis, those nodes are swollen.
Hmm. Okay. Okay. Excellent. And I'm assuming every time I see the emergency room providers, nurses, physicians, most of them, if the hospital is supplying for them, most of them are going to have eye protective gear. And I'm assuming this is basically the reason because, you know, most people are focused around mask wearing and glove wearing. But it's interesting, extremely interesting to now learn that through the same respiratory droplets that could infect the respiratory tract, if they were to land on the eye, there's also a significant risk of infection. Would that be accurate, Doc?
Yes, there is the risk if a droplet gets into your conjunctiva, and somebody cough and it touch your eye, that can happen. But as I said, it's not a common thing, but can happen.
Yeah, and
And
so
that's one of the reasons why if you have practice, optometry practice or ophthalmology practices open that they are doing like emergencies, they're wearing masks protecting the nose and the mouth and also protecting the eyes. And on top of that, they're placing a shield in the instrument, the microscope, between the patient and the doctor. Also, again, trying to protect the doctor.
so here's a question, because something that comes to mind is if somebody is has developed the viral conjunctivitis and they might not be aware that this is a potential early COVID-19 symptom or sign, and they're scratching their eye, is it possible that some of the tears that are being generated from the viral conjunctivitis, can they transmit if they're touching other surfaces and other people and they're scratching their eyes? Is that, do you know if that would still be a source of infection or infectivity for
Yes, they have been doing studies on that, and they have not been able to say that that is happening. Okay, but as you know, this is a new virus. Okay, that we are learning how it is behaving. Okay, but so far, the possibility is there, but they have not been able to accurately say that through the conjunctivitis just by touching that you're going to spread it.
Gotcha.
But
Okay.
they're doing the research, and you know that there's a lot of research going on.
Absolutely. So, Dr. Mercado, before we finish up, are there any closing remarks or any additional information that you would like to provide to either consumers, people at home, providers, anything else that you feel would be of value for for those out there that might need more information regarding ocular health and the current problem with this viral infection?
Yes, I would like to say something. For those people that are wearing glasses or spectacles, glasses, disinfect and clear your frames as much as possible. Soap and water, we remember that is a plastic surface many times, other times are stainless steel or they are metal. But the thing is that we have the tendency when we wear glasses to touch our glasses a lot. Okay, so try to wash your hands a lot. Those that are presbyopes, those are the ones that have to wear glasses just for reading after you get older. And if you're not wearing your glasses constantly, the most probable thing is that you're putting your glasses on and off very frequently during the day. Again, wash your hands a lot, clean your glasses, also soap and water if possible. For the contact lenses patient, follow protocols. This is not the time to have a contact lens related complication. Okay. And in terms of, that the plaquenil possibility treating the COVID, be
Mhm.
aware that the clinical trials are ongoing. This is a highly toxic medication. I urge people not to start hoarding on medications and taking the medication because it can cause damage to your vision at least.
Are you talking about the hydroxychloroquine?
Right.
Yeah.
Yes.
Okay. Okay.
Mhm.
Yeah, that's really interesting. And I also interviewed an ER physician. She was telling me that in addition to the ocular complications, there's also cardiovascular complications related
Yes.
to it. Yeah.
Mm-hmm. Yeah, it's a highly toxic medication. It has to be used carefully.
Okay.
Yeah.
All right, Dr. Mercado. Well, I will tell you, this has been so incredibly valuable, and there's so many people that I hope that this information lands in their hands, because this is just such an important piece that most people are not even thinking about, the possibility of contracting infection just by touching their eyes and touching
Mm-hmm.
their glasses and stuff that they do so routinely, like, care for their lenses or put their contact lenses in. You're allowing us to understand that this is an additional route of infection. So thank
Right.
you so much for your time this
You're
morning and for
welcome.
giving so freely of yourself. Hopefully we
Thanks.
can have you back on the podcast as things continue to evolve in the next few weeks and in the next few months, as we get to learn more and more about the infection.
Thank you, Dr. Valdez. It was my pleasure.
Thank you. Have a great day.
You too. Bye.